Our work in health as part of the Peak Project looked at a particular phenomenon that's emerging around health in cities of the global south. What this is that while communicable disease, cholera, diarrhea, malaria, typhoid, have been long the focus of primary health systems and health in developing countries, there has been, over the last 20 years, an increased realization that non communicable disease, which were often called lifestyle diseases, diabetes, hypertension, obesity, cardiac issues, that were thought to be associated with more elite levels of economic development, actually are widespread in low income communities. Now, this creates a very particular challenge for our health systems. How do we take primary health systems in low income urban neighborhoods designed for communicable disease and preventable health to transform them into places where new non communicable disease care and management can be undertaken? So, our work looked at the way in which the circumstances of living in a low income urban neighborhood in a city of the global south, the economic circumstances, the spatial form of the neighborhoods, the nature of informal work, the ability to interact with health systems, how these shaped the management and living with chronic disease. These health histories informed by a medical anthropological approach gives us a sort of thick archive that thinks about both the E and the K of peak. It's an emergent question, it requires new forms of knowledge, and a lot of our work is basically indicating that the way we think about chronic disease in the lives of the working poor of our cities has to be different from the way we think about communicable disease. Our work hopefully is setting us up for new questions that now follow: what it means for health systems design, what it means to start thinking about new ways to ask health questions in low resource settings. We've started asking questions now about heat stress, for example, on informal workers. Started thinking about the effects not just of non communicable disease, but of climate change mediated through low income informal neighborhoods. These represent new ways of asking questions around health that take us beyond the epidemiological, beyond the biomedical, and start taking very seriously the social determinants of health and the way they particularly impact the urban conditions and contexts of cities of the global south.